My presentation is going to be on Campylobacter gingivi. It is basically a foodborne illness. It is one of the most common foodborne illnesses that Americans get. Probably about 1.3 million of bacteria infections are involved with this bacteria. It's also Greek. Campylos, derived from Greek, means curved, and then the bactrum means rod. So basically, this little character is a rod spiraled with a little thing that swims on the end of it called the vagella. It's also motile, it's microaerobic, and we're going to get started on it. So again, its characteristics here, as you can see. Characteristics there. Um, Again, it is basically, it can be a rod or it could be spiral, a corkscrew. That's how it moves. It's motile. It's able to move because of the flagella, which is unipolar on the end. It's basically helps it with gliding and moving and burrowing right through your intestines. Campylobacter gingivi, the bacteria itself in the flagellum, it actually secretes an antigen. An antigen is a toxic that is basically released into um, your digestive tract while it's burrowing through, and antigens are toxins, so your autoimmune system will recognize it and could basically spike temp because it will um, recognize it as a foreign object. The shape of it is also, it can be arranged in like chain links, or it can be single. It just depends on what angle you're looking at it. Uh, but from basically, it can be single or it can move together. It can appear in chain links. And here we will talk about the signs and the symptoms. So the signs and the symptoms of this is basically diarrhea, vomiting, stomach cramping, gassy. Who does this affect? It affects everyone that comes in contact with this bacteria. Anybody that has had a foodborne illness, anyone is susceptible to it. But this one basically likes to stick with the children. The younger kids get it, the younger adults get it. Mostly common in men more than women, assuming because the men are the ones that's out slaughtering, and the contamination comes from when you're slaughtering and the product of the blood is getting on anything else that is not basically supposed to be around it. When you're slaughtering meat, you should definitely have everything separated. So the signs and symptoms here, back to that, is fever, diarrhea, stomach cramping. So how do you become infected? You can see here's a chicken, and there's a little bacteria. How do you become infected? So you basically become infected when you consume it. You have to get it inside of your system. Um, the other chicken, meats, fruits, eggs, any type of unpasteurized things can also carry gingivi in it, because when you are slaughtering, again, the juices, the blood is getting on the other items that are around it, and it is contaminating, which is cross contamination there. So that is how it is spreaded, and that is how others are getting it. So that's how you become infected. How how am how am I diagnosed? How is gingivi diagnosed? Well, it's basically they take a stool sample and they place it on agar. They inoculate the agar. It's chocolate agar with the microorganism, and then they watch it grow, and then they're able to tell you what's going on here. So it's a stool sample. They also test your blood for bacteremia, because you could have bacteria in the blood. They also check for stool culture to make sure your white blood cell count. They check your white blood cell count through there as well. So the physiology part of it is what is going on here. What is going on here? Okay. So as you can see, this is your intestines, and there is that nice little corkscrew with the one unipolar flagellum on the end of it, waiting to burrow through your intestines. When you consume it, it gets into your intestines and it just burrows through. The motility of this thing helps get through the intestines. It thrives in 45 degrees temperature Celsius. How is it treated? Well, there are a couple of ways. So if you have a severe case, then you will be treated with antibiotics, erythromycin. I'm sorry, azithromycin and ciprofloxacin. So both of those are a product to use if you consume and you basically have a uncompromised or weakened immune system. Those are the ones that probably will end up needing to take the antibiotic. If your body is young and healthy, you should be able to rid this. You just have to replenish yourself with electrolytes and hydrate yourself, because you can definitely dehydrate yourself by vomiting and having diarrhea. So, so moving on. So, what is the outcome, and is Injuji fatal? So, again, the outcome is you can rid this if you have a healthy immune system. This will pass just like any other. Your symptoms will last 2 to 5 days. Um, Basically, in that time, you will need to be on an antibiotic if you have a severe case, or if not, then you just need to hydrate yourself and get that replenishment of the electrolytes, because your body definitely needs those to thrive. Um, if you're 65 years and older, then of course, you should, if you have any underlying diseases that could actually hurt your immune system, weaken it more, make you sicker. So yeah, I would definitely recommend, if you're 65 and older, to not wait and get yourself looked at. So the prevention method here is, what do we do? How can we prevent this? So, some people say, hey, wrap your chicken up when you're leaving the grocery store, double sack it. Some people say keep it frozen. Some people say, hey, I think that we need to wash this chicken. Some people say check the temperature. It all boils down to making sure that you keep a nice, clean cooking area where you're separating your meats from any fruits, or any fruits or vegetables, or any you know other food rather than your meats and what you're cooking. You need to separate those. I work in the healthcare field, and anytime you go to touch a different patient, you need to always be sterile and wash your hands. And anytime you touch meat, that is another very important thing. You need to wash your hands in between. It is important to wash your meat off, but it's also important that you keep that meat and all its contents contaminated in its own area, to basically prevent the spreading, because the spreading comes from when they're in the slaughterhouse, because of the pathogen lives in the stomach when they're slaughtering these chickens. That the gingivi can get on anything, can get on everything that's around it, and it can infect it, and then you can eat that, and then it then infects you. It affects you. It infects you. So here, at the end of the day, it's all about being clean and washing your hands. 93% say, hey, wash your hands and be safe. So here are some sites. If you want to learn more about this gingivi, Campylobacter gingivi, please go to the website. I say the advantages of, getting this if you're young, then your body will fight it off. I say the disadvantages is if you don't have a healthy living inside of you. You know, if your immune system is weakened, then I would consider you going to the doctor and taking what they say to take for the antibiotics. So you have a good day, and I hope this helps everyone.